Um, as you will see on your GoToWebinar control panel, you have two options for listening today, mic and speakers or telephone. So if you are having trouble listening with either option, try and switch and see if that helps. Also, please feel free to put any questions into the question box, and I will help provide any technical assistance you might be having with any sort of audio problems throughout the webinar. We will be recording this webinar today, and we'll have it archived on our Brain Injury Alliance of Iowa website in the coming days. That web address is biaia.org. Also, we will save a few minutes at the end of the session for any questions you might have. No CEUs will be provided for this webinar. However, a certificate of attendance will be sent to all attendees following the session through your email. Also, we have attached the PowerPoints for this webinar in the handouts portion of your control panel, so please feel free to print those off. Now I would like to introduce our guest speaker today. Dr. Michael Hall is currently a neuropsychologist at the Iowa City VA healthcare system, Adjunct Assistant Professor in the Psychiatry Department at the University of Iowa, and Vice Chair of the Governor of Iowa's Advisory Council on Brain Injury. He completed his master's and doctoral training at Kent State University, internship at the University of Massachusetts Medical School, and postdoctoral fellowship at Harvard Medical School. His clinical research and training interests include a focus on traumatic brain injury and common co-occurring problems and how such problems impact overall rehabilitation, including employment following injury. So thank you all for participating, and I will go ahead and let him get started.
All right, well, thank you so much, and thanks everybody for attending. I am a neuropsychologist, and as a neuropsychologist, we typically don't get too involved in employment. My interest in employment really plays into overall rehabilitation. In some respects, after traumatic brain injury, return to work is one of the last stages of rehabilitation, and it's often one of the more complex areas to get back into, and I'll highlight some of those both in a case sample and a review of some literature. Let me just start off with, let's see. Okay. All right, just some disclosures. I unfortunately don't have any financial relationships with proprietary entities that produce healthcare goods and services, though I'd like some if possible. The opinions expressed here are mine, not of the government, the state, or the university. And here are the objectives of the webinar. Better understanding of the cognitive, emotional, physical barriers to returning to work after experience of brain injury. Better understanding of factors that are predictive of whether somebody who has sustained a brain injury might be able to return to work. And better understanding of the benefits and the problems that individuals coping with brain injury experience when they're able to return to work. So as you'll notice as we go through this, there's no one size that fits all. And also there's no ability to generate an algorithm to indicate those individuals who should be able to return to work or can return to work and those who can't. It's a very complex issue, but one that I think with a team approach can be addressed very, very effectively. Just to start off, just terminology-wise, a traumatic brain injury is considered a blow or jolt to the head or a penetrating head injury that critically disrupts the function of the brain. Not all blows or jolts to the head result in a TBI, and the severities of such injuries may range from mild to severe, and my next slide sort of covers that. So a mild traumatic brain injury, and there's this is generally considered sort of the levels of traumatic brain injury. There is some discrepancy across CDC versus other areas, but a mild traumatic brain injury is altered consciousness, either being dazed or confused, with a loss of consciousness up to 20 minutes. If there's positive MRI images, if there's seizures, it's called a complex mild traumatic brain injury. Moderate traumatic brain injury is a loss of consciousness for 30 minutes to 24 hours, and a severe brain injury is loss of consciousness for more than 24 hours. In general, those lengths of time of loss of consciousness, and I'll talk a little bit more about that, are predictive of recovery to some degree. However, those individuals with mild injuries can sustain significant deficits, while those with severe injuries can recover fairly well. So it's not 100% correlation between the injury severity and outcomes. Just to give a sense of the degree of problems that traumatic brain injuries represent in this country, this is annual incidence. You'll see that there's 1,500,000 brain injuries sustained per year in this country. Estimates actually go up towards 250. A lot of people don't go into the emergency room or don't see medical attention. But if we compare that to some of other illnesses that certainly garner a lot of attention and a lot of research support, traumatic brain injury is very significant. I work in the VA, and one of the reasons that brought me into the VA is my particular interest in the comorbidity of traumatic brain injury, psychological problems, and physical problems that are co-occurring, and how those affect functioning moving on. This shows the number of brain injuries sustained in the military population between 2000 and 2015. I won't go too much into the military aspect, but there's 334,000 individuals have sustained at least a mild traumatic brain injury, fortunately with the majority of those being mild. Although, as I'll talk about next, we're seeing a lot of people, particularly in Iowa. I think that's partly because we had some combat engineer groups who have multiple exposures. So within our polytrauma clinic, which is our clinic set up to deal with traumatic brain injury, of the first 500 people seen in the clinic, they averaged 3.5 blast injuries each. So those were individuals who were deployed to Iraq or Afghanistan, were in combat, and experienced multiple mild traumatic brain injury. So the estimates are that about 20% of those veterans were exposed to IED explosions, which are improvised explosive devices, and that resulted in 70% of injuries and fatalities during the conflicts and the ongoing conflict in Afghanistan as well. Estimates vary in rates of traumatic brain injury. It's unclear how much traumatic brain injury is causing lasting problems, or whether PTSD or post-traumatic stress disorder, depression, other physical problems are impacting functioning. And there's some question as to whether blast exposure represents a different kind of traumatic brain injury than we're used to. And there's some question as to multiple exposures being related to the athletic research, which shows in professional athletes a risk of chronic traumatic encephalopathy. Although we are certainly not there within the veteran population, but certainly people are paying attention to that. This is just a brief top 10, and it's just to point out some of the areas that are often affected by brain injury: memory, attention, communication ability, speed of thought and action, problem solving and planning abilities, mobility, fatigue levels, judgment, emotional and behavioral control, and initiation and motivation. And I think all of you could sort of think about how deficits in any one of these areas could really pose problems in all aspects of rehabilitation, but particularly return to work. For the purposes of this presentation, when I'm talking about work, I'm really talking about full-time competitive employment, part-time employment, and volunteering. Essentially, some meaningful activity that provides an individual with an outlet to do something productive, to engage in social activities, to engage with other people, and to have a sense of accomplishment. So in no way am I suggesting that everybody attempt to return to full-time competitive employment. And I will talk about some of the downsides and studies where that's happened, and some of my personal experience when people have returned to work and it hasn't gone so well. So volunteering certainly falls within this area. So what I want to do is to start off with a case sample, and this, along with a number of other very similar cases, really got me more invested in becoming more involved in employment and seeing employment as a critical component of rehabilitation. So this involves a 35-year-old married Army veteran with 2 teenage children. He sustained a sports-related concussion with a very brief loss of consciousness. Took a baseball bat, an errant swing to the temple, was knocked out, I think, for about 20 seconds. Prior to his full recovery, though, he was riding on his motorcycle with no helmet, got into a crash, and was thrown into a vehicle and sustained a complex mild traumatic brain injury, whereby there was a bleed in the brain, and he developed a seizure disorder afterwards. Changes in personality, whereby irritability was really an issue, mood problems, and then lasting difficulties with attention and short-term memory. He was discharged from the Army because of seizures, and essentially that's a disqualifying disorder because I suppose if you have a seizure in a military context, it can result in more problems. So he left the military and went into a federal job that was incredibly high stress. This did not go well, At that point, he had not received any rehabilitation. So essentially, it was after the hospitalization, they discharged him very quickly from the military, and he had to support his family. So he took a job. It went very poorly, and he ended up on Social Security disability and a full VA pension, which provided some financial security. So he didn't have to worry about whether or not he could take care of his kids, that he could keep his house, those sort of key factors that income provide us. He came to me about 3 years afterwards because of anger problems, feelings of emptiness, and a, quote, desire to feel normal again. And really, so this was for a psychotherapy case rather than a neuropsychological assessment. And the constant themes that came up in therapy was his reporting too much time. So essentially, his wife was off to work, his kids were at school, and he had too much time during the day, and it would really cause him a lot of problems. Ended up resulting in him developing a bit of a gambling problem, more because I think that there was a social support system at the casino. Got to know several of the dealers and other people that went there frequently, and that ended up resulting in a lot of stress in the relationship. He reported problems finding friends of the same age, able to do things during work hours. He said all the people my age are off doing, working, and if I want to go hang out with retirees, I don't feel like I fit in. So he talked a lot about feelings of worthlessness and being unimportant, and also unimportant in his family life as well. He also had a fear of social situations where he might be asked what he did for a living. As many of you know, traumatic brain injury often is a silent injury whereby somebody looking at you may not be able to tell you have an injury. And one such incident when somebody challenged him about why he wasn't working, it resulted in a physical altercation. After that, he was very reticent to go out into situations where he would have to answer the question of, what do you do, and indicate I'm disabled. He would struggle with it, oftentimes actually, sort of painting over the truth to a degree, just to save himself from feeling embarrassed and from potential conflicts. He also wondered about how he was going to be able to instill work values in his children, and his children were teenagers, and they were struggling, and often would use his disability and being home as sort of an excuse for their not being responsible. And he felt a bit of a hypocrite, but he did understand that his situation was different, and he tried to convey that, but he really struggled with it, and it really altered the family dynamic, if you will. Anger and depression were present. Some of that was probably tied into the brain injury, but a lot of the depression was related to deficits and the limitations that the brain injury had on him. One statement that really stuck out to me was that he said, "I'd rather have lost my leg than to have a brain injury. At least people would then see my problem. People would be able to understand why I'm not working and understand why I have problems with my mood, temper, and my thinking." And that was pretty astounding for me at the time. I was somewhat taken aback by that. So I'll come back to this. I want to come back to this case sample, but first I want to review some of the research findings with respect to return to work after traumatic brain injury. So there's some pre-injury factors associated with a greater incidence or greater likelihood that somebody will be able to return to work. Now, the ones I've listed here are the ones that tend to show up most in the literature as being positive predictors. They're not always predictors, but certainly they're the ones that seem to cross different studies to have an impact. The first is the age of time of injury. So the younger you are at the time of injury, the better chance you are able to return to work or to start work. Pre-injury education level, those who had higher levels of education, maybe finishing high school, college, had a greater chance of returning. For some reason, men had a greater chance of returning to work. I'm not quite sure why. Occupation type also had, pre-employment occupation type also had a significant impact. Those people who were in managerial or professional positions had a greater chance of returning to work. Those who were in skilled laborers had a little bit, also had an increased likelihood. And those who were doing manual labor jobs had about 3 times less chance of returning to full-time employment following traumatic brain injury. Those who were unemployed at the time of the injury were 40% more likely to be unemployed following traumatic brain injury, and those who were students at the time of injury were 56% more likely to be unemployed. And that latter one makes a little bit of sense because they weren't finished with their training, they hadn't started work, they hadn't developed a work history. So going back, returning, and finishing school is often very challenging following a traumatic brain injury. So some injury factors associated with predictive return to work. The major one is injury severity, and that shouldn't be a surprise. The factors that have been shown to be predictive include the length of post-traumatic amnesia, so the amount of time that somebody can't remember either immediately before or after the traumatic brain injury was predictive. The length of loss of consciousness, which goes back to that rating of mild, moderate, or severe traumatic brain injury. And then comorbid injuries. Those with more physical injuries certainly had harder time returning to work. So some post-injury factors that were associated with greater chances of return to work included about 4 things, and then I'm going to get to a whole list of other factors that weren't consistently shown, but occasionally shown to be related to increased greater chance of returning to work. So those individuals receiving vocational rehabilitation, and I can't stress the importance of vocational rehabilitation in those who sustain traumatic brain injury. This includes job coaching, this includes job exploration, on-the-job training, and then continued supports moving forward. I've always said that brain injury rehab is a team sport, and I think vocational rehabilitation is a critical component of that team. So another factor that was more predictive of being able to return to work was those with fewer cognitive problems, particularly memory, attention, and processing speed in particular. Emotional problems, including lower levels of anxiety and depression, behavior problems such as acting out, or particularly those with maybe frontal lobe injuries where there was a little bit of inhibition problems, and those with fewer physical limitations. Another factor was an increased self-awareness of the problems the individual was experiencing. So if the person had insight, then there's the ability to work around those problems. There's maybe an increased acceptance in the need for additional help. Those people who lack self-awareness, and that often goes along with the frontal lobe injury as well, had far more difficulties returning to work. The last one is somewhat surprising. Being able to drive or having driving independence was a major predictor. And I guess if we think about that, particularly in Iowa, where we're a rural state with, I would say, very limited public transportation, being able to travel to and from places really does matter. So having that independence and being able to, get oneself from place to place was really also an important factor. Now this is data that was taken from several review studies that looked at factors that were found to relate to return to work. And if you just take a second and look over some of these, I mean, some of them are certainly more important than others. Others are somewhat vague. So let me give you an example. On the second list, there's the width of the third ventricle. So in some respects, if there was some sort of change in brain anatomy, that was predictive, but I don't know why it would be the third ventricle. So some of these findings may be spurious or just based on statistical aberrations. Other ones are, I think, far more important. Certainly, I've seen people with dizziness not be able to return to work because of that. So I'll sort of move on from here because there are so many. So some statistics regarding return to work following traumatic brain injury, the range is very, very large. So if you'll see that between 18 and 88% of individuals are unemployed following TBI up to 5 years. And really, I think the range is so high because this includes samples of people with mild traumatic brain injuries, complicated mild traumatic brain injuries, moderate and severe traumatic brain injuries. And I'll present some on both moderate and severe and then mild complicated to show some of the similarities and discrepancies. Culberth did a seminal study where they looked at 1,123 individuals, and they were able to, they indicated they did some statistical modeling where they were able to extrapolate the findings from that to estimate a sample size of 66,000 people, which is an incredibly high statistical sample. What they found is that 60.4% were unemployed 3 years post-traumatic brain injury. 25.7% were part-time employed, and 13.9% were, 25.7% were full-time employed, and 13.9% were part-time employed. And if you compare this to the general population unemployment rate of 9% during the same period of time, that shows really vast, significant differences. So if you combine the unemployment and part-time employment, we're getting up to about 75% of the people in the sample were either employed or underemployed at the time of the study. So those are pretty significant numbers. Ponsford et al. did another study looking at looked at 236 individuals. Most of them had complicated mild traumatic brain injuries. The majority had positive MRI or neuroimaging abnormalities, seizures, and physical problems. And in this sample, it's 55.9% were employed at 1 year, 33.5% were employed at 2 years, and 58.5% were employed at 3 years. One of the things this highlights, and there's other studies that do this, is that employment isn't, once you obtain a job, doesn't necessarily mean you're going to be able to sustain that employment. And the differing in numbers here, and I didn't go into too much detail, highlight the fact that there was a number of people who returned to work, it didn't work out, weren't working at at year 2, we're working at year 3, and vice versa. So employment wasn't a static process. We saw a lot of people switching in and out of employment versus unemployment. So as far as data goes, unemployed TBI survivors, some of the research has shown that those individuals who have sustained traumatic brain injury and are not able to work because of that have increased rates of depression and anxiety. They report reduced overall psychological well-being. They don't feel like they cope as well. They don't feel like they have the family structures or the social supports. They reported higher fatigue levels than those who were able to work, lower ratings of quality of life, less involvement with the broader community, reduced social interactions, reduced involvement in family activities, and reduced participation in leisure activities. Now, one of the things that could account for this, one could think, is that this is just due to this sample having more severe brain injuries. That's actually not the case here. These are studies that have controlled for injury severity. So looking at individuals who were employed versus unemployed and looking at the differences in how they were doing. So really, this is not necessarily a function of how severe the brain injury, or these individuals had more severe brain injuries than the next slide I'm going to be addressing. So the potential positive outcomes that were found is increased income, access to health and life insurance, a pension, 401k, access to 401k, lower levels of depression and anxiety, increased self-esteem, increased sense of purpose, quote, feeling normal, having a structure to one's day, and less need for medical services. In addition, some of the other findings were individuals were less dependent on others, including family members, friends, and on support programs, including government support programs, and then increased reported quality of life, increased reported psychological well-being overall, and interestingly, the higher level of involvement in work activities, the greater increase in quality of life. I'm going to give an example, and I'm not trying to be insulting with this, but so an individual who returns to work stuffing envelopes was not likely to report the extent of increasing quality of life than somebody who felt like the work that they was doing was particularly mission-oriented and had a worthwhile outcome. So that sense below of having a sense of accomplishing something worthwhile, that was very critical and one of the most critical factors as far as how the individual perceived work and having that and how that perception of what work was doing had on the quality of life and on their psychological well-being. So from the literature, some potential negative outcomes for return to work were increases in depression and anxiety, increased fatigue levels, interpersonal difficulties, and increased problems completing other activities outside of work. So from a clinical perspective, issues that I've seen when people have attempted to return to work and it hasn't gone well, or attempted to go back to school and it hasn't gone well, what I've seen is, and these are typically temporary if we're able to deal with it in the appropriate way, Feelings of lower self-esteem, feeling like a failure. Anytime that you start something and it doesn't work out, I think that there's that potential to sort of have that negative self-appraisal. Not doing well in the position or not being able to perform the job activities really highlighted the deficits that those individuals have, and really sort of took home the limitations of the brain injury. Which often, not surprisingly, resulted in having to really deal with grief issues over losses related to functioning in traumatic brain injury. So that would often be a follow-up that we'd address within the psychotherapy context. Potential loss of current supports. So that includes the friends that they made at work. It could also include pre-level support. So individuals who are receiving services, when you return to work, if you're on disability, it could put that in jeopardy. We're very careful when I'm working with somebody about return to work, whether not to jump the gun and have somebody jump into work, get off of Social Security, disability, or whatever benefits they may be receiving prior to seeing whether or not it's going to be a successful return to work, because having to start that process over again is very difficult and very demoralizing. So that's an important factor. And then a temporary increase in symptoms, noticing cognitive problems more, being more focused on the problems that got in the way of work. And I think that's a very reasonable response that somebody would have if things didn't go well. I can tell you that clinically, oftentimes how I've dealt with situations like this is to portray this as a trial and to learn from what happened and to try to continue to move forward to have that person continue to try to re-engage in some form of work activity. And again, when I describe work, that includes full-time work, part-time work, and importantly, volunteering. I've seen a lot of benefits with people volunteering because you're able to, be involved in something with a mission that's bigger than oneself, to be able to help people, to be able to get positive rewards, positive feedback. So I want to return to this case sample, and I realize I'm going way too fast for my slides, so I hope there's a lot of questions. With the individual that I was working with, we finally came to the decision that it was going to be critical that the individual start to do something outside of the house. We looked at, different sorts of supports organizations, volunteer opportunities. Those didn't work out well. And then also figuring out the limits of how much he could work without jeopardizing his benefits. So he was on Social Security, and I think as long as you make below the poverty level, he could get a part-time job and it wouldn't place Social Security in jeopardy. So that was an important factor because with this individual, neither of us had an expectation that he would be able to return to full-time work. Rather, he was looking for work as something to provide meaning in life and structure to the day. What we did is we worked with vocational rehabilitation to see what areas interested him, how those interests corresponded to the deficits that he had and to the strengths that he had as well. So really looking at this from a strength sort of weakness factor and trying to play towards, highlighting the individual's strengths. This individual was very detail-oriented and liked to work very hard. So physically, so finding a position or finding some sort of opportunity that fit with that was very important for him. We also developed scripts to allow him to explain to others about what his injury was, so that he wouldn't have a similar situation whereby somebody would challenge him and say, there's nothing wrong with you. You look normal. You should be working full time. But to develop scripts maybe to deal with customers, because he wanted to look into some retail positions, for management, and then also for family as well. This was a absolutely critical component of what we did, because that experience whereby he had actually gotten in a physical altercation with somebody who really said, you're sponging off the government, you need to get out there and get a job, had almost resulted in a social phobia whereby he would avoid social events where, or mingles where those conversations would come up. And that resulted in some stress within the family. His wife was very social. He would avoid those activities. And so we also focused on developing scripts, prior to return to work for those situations, but he continued to avoid. But the fact of getting back into work, or to getting into him seeing himself in a situation where he was able to, be an expert in something, or to be able to help other people, reduced his anxiety enough that the scripts were sufficient enough for him to feel like he had the skill set to address any of these sort of negative potential social interactions that really could have set him back a significant way. He tried to obtain volunteer work. That was without luck, unfortunately. But fortunately, he found part-time employment that was consistent with his hobby of outdoor activities. Seizures were under fairly good control at that point, so he would often run. He did some biking, and he was able to essentially at the outdoor stores position, really be an expert in equipment, in helping people sort of figure out plans for weekends. Really fit really well within what he liked to do outside in his spare time. Initially, he had a hard time making friends. He felt like an outsider. He felt like everybody could see that he had problems, that his problems were sort of open to everybody, or that people were assuming that he should be working full time. So, dealing with these, very carefully in therapy and sort of processing this, he was able to make some friends over time. It typically started with work-related activities, social functions at work. Fortunately for the position that he was in, they would do trials of new sports equipment, and the staff sort of working together to try out a new canoe. Those things led to the development of social interactions that were positive, and then developing social support system at work. There was some issues with him being older than the other people that worked at the store, but I think overall, he reported a significant improvement in feeling that he was socially connected. He reported a significant sense of increase in purpose, especially advising others on sports-related activities. He was so enthusiastic about it, and that enthusiasm really grew over time. The people at work really appreciated his work and what he did, and received a lot of positive feedback. I think that if that hadn't been the factor, that really would have turned the corner as well. So there's a lot. This is just sort of points out the complexity of there's a lot of different factors that can help somebody return to work, or can really result in that situation being negative. And hopefully involvement with vocational rehabilitation and others can mitigate some of those factors. But having that supportive work environment where they understood what issues that he had, and if they arose, that there was ways to work around it, really resulted in him feeling like he was a part of that store, that group, and that company. Interestingly, he stopped gambling, said he wasn't interested in it anymore, didn't find any reason or purpose for it. There was also a reduced need for some services. So he sort of dropped off my caseload, and it was somewhat sad to see him go, but that was very rewarding to see that these issues weren't, he was having a lot of things to do during the day, and his levels of anger and depression really got much better. I mean, there was some irritability that would kick off the bat, but that was more tied into the etiology of his frontal lobe injury. But we worked on ways to control that, so that was under far better control. His mood and cognitive problems persisted, but really, he really talked about an increase in quality of life and general satisfaction. He also felt proud that he could, address his kids in a different way when they sort of talked back to him about, well, you're not doing this, why should I have to? And feeling like he was contributing to the family, even though it wasn't a lot of money. He felt like he was, again, sort of being a part of a whole family structure. Interestingly, he started attending more social events with his wife. I think that resulted in an improved relationship. So there was a lot of secondary gains from returning to work. And that's really one of the main factors why I'm so interested in return to work, and have started to really have this to be one of my clinical focus, because not only does it provide somebody with the structure during the day, with something to do, with a sense of purpose and meaningful activities, it also hits a lot of different other areas, and those areas are really critical to how we feel about ourselves and how we feel we fit into society. And all too often, people with disabilities or traumatic brain injury feel like they've lost that connection with the broader sense of society. They feel different or separated. And that is incredibly unfortunate and can be very much, have a very much deleterious effect on mood and hope for the future as well. So what I don't want to do here is to say that employment, whether it be full-time, part-time, or volunteer, is the absolute necessity for all individuals who experience a traumatic brain injury. That's not realistic. I think that that needs to be figured out on a case-to-case level, where key factors are looked at, such as residual problems, barriers to employment, including transportation, what the individual's interests are, and how those meld with employment opportunities. Not just getting any job, but getting a job that the person is interested in and then also feels like they're doing something worthwhile. Including the family in this as much as possible and family support. There's also a double-edged sword with that. Certainly I work with a lot of parents who are very worried about their children, adult children who have sustained traumatic brain injuries, and really push to get them to return to work or return to school. I understand that. I'm a parent as well, and certainly could see, understand where they're coming from. But really, there's a lot that needs to go into figuring out whether or not that fits that individual, and that's sometimes a complex interaction of a multitude of things. So hopefully, when one's deciding if you're a provider, if you're working with somebody, if you're a family member, if you're a survivor of brain injury, hopefully that you'll be able to pull in your treatment team to really look at all the pros and the cons, and then develop a clear plan moving forward where there are supports that are in place. Times that I've seen things not go right is when there's a lack of supports or a lack of communication with employers, whereby they don't really quite know what deficits are. They may attribute problems to personality factors, to motivation, and that often makes it harder to come in once problems develop and mitigate those problems with reasonable accommodations. Reasonable accommodations are another important factor. So determining whether or not, what the person's going to be doing and how cognitive, physical, or emotional problems could potentially limit what they're able to do. Having that information and having an open and honest conversation with the employer so that so everybody's on the same page as far as expectations has also been found, I've seen to be very important as far as outcomes go. And really, I can't stress the team approach, if you will. So not having this be an individual just going out and searching on their own, but really working within a broader support system to develop sort of a path forward that tries to optimize chances of success and to mitigate the factors that really can get in the way. Well, I talked about 15 minutes quicker than I had meant to, so I want to open up the floor to questions.
All right, yeah, we'll go ahead.
Or comment.
Oh, are you there?
Yes.
Okay. I'm just going to look here real quick to see what we have. Just a moment. We had a couple of professionals on today who just wanted to reference the benefit planners that are across the state and how they can help with planning for benefits. If you have if you are utilizing Social Security income or have benefits through that, how that works with your employment. And there are planners throughout the state, and we do have an archived webinar on that at our Brain Injury Alliance of Iowa website. So if you have a more interest in kind of learning about that one is on our website, and it was presented by Diane Hernandez and Brian Dennis. So please feel free to go there for more information on that. Also,
and that really that does really bring up a critical point of, one of the concerns about return to work for those who have, who are on Social Security disability or on other forms of disability, being sure that you're working within that system is critical because, there is the risk of, if you were to return to full-time employment, that you could lose those benefits. You want to work with those individuals to make sure that, it would be wonderful if you're able to return to work full-time, but if not, that you work within the parameters of those programs so that you don't jeopardize benefits that are often absolutely critical. So yeah, so certainly working with those planners makes an incredible amount of sense.
Very true. Yeah, and folks, if you are interested in that, that is on our website. So please feel free to go there, and that's our archived recorded webinar on that topic. While I allow some more time for folks to kind of get their questions in, just a reminder to please reach out to the Brain Injury Alliance of Iowa if you are in need of brain injury resources or information. Our Neuro Resource Facilitation Program is designed to help connect individuals with brain injury along with their loved ones and the professionals that serve them to needed supports and services in their communities. And the Brain Injury Alliance of Iowa is always available to provide case consults to professionals if you have a client with a brain injury and you are looking for resources or support in figuring out what to do. We are also available to provide general training on brain injury, and our Neuro Resource Facilitation Program can help out with that. So I will look to see if there's any other questions, and it does not look to be any other questions at this time. Oh, here we go. Someone is asking if you use social networking tools for individuals.
Oh, that's a good question. I have yet to figure out how social networking helps with employment, and that may be a generational issue. I'm assuming maybe LinkedIn, those sorts of. Is that a correct guess?
It's from Mary Lynn. So Mary Lynn, if you have any more specifics, please type those in to help Michael with the question. But that is all she wrote so far. Is networking.
So one. I think that social media is going to continue to expand as far as being able to provide opportunities and to connect people. However, what I would like to stress is also Iowa Vocational Rehabilitation as well. I mean, that's a lot different, but they do provide a lot of supportive employment, including resume building, job coaching, interest inventories, and then on-the-job training. So certainly, that would be another factor. But certainly building out networks, introducing yourself to others, applying for a multitude of jobs, and seeing which one's the best fit, I think makes a lot of sense. Getting a sense of whether managers are understanding and appreciate both what the individual brings to the table, and in the context of potential limitations, is also very important as far as it being a good fit for both the individual with the brain injury and the employer. We want it to be a good fit for both, for everyone essentially, because if it doesn't work for one side, it's typically not going to work for the others. So involvement of employers as possible, is another really important factor.
Well, thank you. I think that is all of the questions that I see right now. I just want to thank everybody again, and just as a reminder that this webinar was recorded and will be saved on our website at biaia.org in the coming days. And also your certificate of attendance will be emailed to you along with a link to a survey for your feedback on the webinar. And thank you to you, Michael, for being with us today. Do you have any sort of closing thoughts before we wrap up?
No, I appreciate everybody listening in, and I hope this has been of some benefit. So thank you. And thank you to the Brain Injury Alliance of Iowa for doing all the wonderful work you guys do.
Well, thank you. And I hope you guys, everyone who was on today, I hope you have a great rest of your day. Thank you, Michael.
Okay. All right. Bye.
Bye.